Thank you so much for joining us for this Austin ISD virtual town hall with Superintendent Dr. Stephanie Elizalde. My name is Alex Capriello. I'm the education reporter for KXAN News. I'm going to be your moderator for the evening. Obviously, if you live here in the Austin area, you know that things are changing day by day and hour by hour. It's forced a lot of school districts all across the nation. Austin ISD is no exception to pivot and make changes. That's the reason that they wanted to offer this town hall for all the Austin ISD families to offer their questions and their feedback to some of Dr. Stephanie Elizalde's leadership team. Let's go over a few ground rules because obviously we all have lots of pressing questions that we want to get through. There is going to be both questions that have come in through some of those questions up in the virtual format. We ask that you stay muted and raise your hand, and then we will add you to a queue, and I will be picking those names out. You'll have a chance to speak up and ask your question and offer your feedback. The AISD team is also assembling some questions, which I'll be reading from this iPad. Before we move any further, let's go ahead and introduce some of the leadership that's here on the stage with me. First and foremost, Superintendent Dr. Stephanie Elizalde. We have Chief Academics Officer Elizabeth Casas. We have the Director of Health Services, Alexandra Copeland. And we have the Chief of Schools, Dr. Anthony Mays. And in just a little bit, the Chief Human Capital Officer, Leslie Stevens, will also be joining us. Thank you all for joining us today.
Thank you.
Dr. Elizalde, why don't we let you go ahead and open it with a few brief remarks.
Well, first, Alex, thank you for agreeing to moderate. We really appreciate it. And I want to thank everyone who's tuning in. We are working very hard to provide as many responses to those pressing questions that we know our community has. Schools should be an exciting, fun, safe place, and we are going to continue to do everything we can with the help of our staff, our team members, our parents, and our community to ensure that we do just that. And so some of that is going to require us to also encourage each other to do what science says we need to do. But we want our kids to look forward to this new school year. Enthusiasm and safety can be both and rather than either or.
Fantastic. And obviously, this is a dialogue between all of our families, and we want to encourage everyone on stage to join that dialogue. We don't want to take any questions as if it's for one specific person. If you feel like you have something that you want to share with our Austin ISD audience, and I'm sure plenty of other parents out there that are watching to see what the district is doing, please, by all means. You brought up school being a fun, enjoyable, and place that we all need to be. And in fact, that day is coming soon. August 17th is the first day of school for Austin ISD. So let's talk about what is being encouraged, which is to attend school in person. Can you all take a minute to explain exactly what that's going to look like from both an academic perspective and a health and safety perspective?
I'll start off, and then I'll ask our other team members to join in. I think it's really important that when we do follow the science, we follow all of the science. And so that begins with the CDC acknowledging that it is best for students to be in person in a face-to-face setting. That being said, there are a lot of things that we can do to ensure that that particular experience is very safe for our students and our staff. So we're really working, again, from the both and perspective, recognizing that we must put our connections before we put our content. But we can do both in a very safe way. Maybe one of the other team members wants to add from the academic standpoint.
Sure. So we want to really change the language of learning loss this time that our students haven't been in school. Our students didn't stop learning, and they didn't learn and lose it. We've lost some time with them, but we want to make up ground this year by really accelerating instruction so that students have rigorous content when they come back to the schools, and that we are working really hard to provide our teachers with the tools to be ready for students when they come back so that we can have a welcoming, inclusive environment, and that we're ready to hit the ground of learning from day one, August 17th. So we're excited to have our students back in person on August 17th.
And Ms. Copeland, can you talk a little bit about health and safety? There are the obvious protocols, which we all know by now, the hand washing and the disinfectants. But what else can we really see in terms of specifics? And also, can you share the reasoning why some things were removed from AISD's protocols, such as temperature screenings and at the door checklists?
Absolutely. So like Dr. Elizalde said, we're really looking at the science from the CDC. And so we are encouraging masking, but it isn't just about encouraging masking. We know that that's what works and that's effective, and it's going to take all of us to keep us all safe. As far as the screenings go, we did remove the temperature checks just because as the pandemic has gone on, research in medical science has shown that it's not really as effective. And also outside temperatures affects the temperature readings. So we did remove that, but we are encouraging people to screen at home. And a couple of reasons for that. For one, if people have symptoms, we want them to stay at home. We don't want them to come up to school. And again, we all have a responsibility in keeping each other safe. We're still going to have the COVID screening app available for those that want to use it. And we're encouraging people to use that and screen with those questions. And of course, when they come to school, if there are people that do have symptoms, we'll have rapid testing on our campuses, and nurses can go and intervene and provide support to our students. So we're making sure that we're keeping our health and safety measures in place that we had last year. Schools are the safest environment for kids to be in, and we know that. The research shows that. And we know that we did not have any outbreaks in our classrooms last year, and so we are keeping with those health and safety protocols that we had last year.
We hear a lot that in-person school is where we want our kids, but without seeing the numbers, of course, I do know anecdotally from all the people that I speak in our community that there is a high demand for virtual learning. Austin ISD just recently said that they're going to open the door for anyone who wants it. But I think what a lot of people are still wanting to know, and hopefully want to know before the deadline closes tomorrow night, is what exactly that virtual learning is going to look like. In specific, some of the questions that I received is how many hours a day are they going to be doing that, both synchronous and asynchronous learning? How are the arts and the sciences going to be, and the PEs going to be handled? And whether or not it's going to be small group led or if it's going to be Zoom in a room, large classrooms where it's not as organized as some parents might like. Can anyone explain sort of what that virtual setting is going to look like?
I'll make one statement and I'll let the other chiefs give you more of the details that I think are really what the question is around. We learned a lot and we learned a lot what not to do. So I do know that having students nonstop on a screen was not also effective. We also know teachers trying to do both, concurrent teaching in a classroom with students that were there face-to-face, along with students who were Zooming, was also a nearly impossible task for our teachers to take on. So we are still, and I want to say that again, recommitting. We will not have concurrent teaching. So it will be a separate teacher that will be working with students whose parents have elected the virtual option. Ms. Casas, I think, can add a whole lot more detail to that.
Sure, so the instructional hours will be the same as if they were in person. The day will start with the morning meeting with the teacher. There'll be a whole group lesson with the teacher and all the students. And then throughout the day, there will be a mixture of asynchronous, where the students are working independently, and synchronous, where they're working directly with the teacher. So there'll be opportunities for whole group instruction and then small group instruction throughout the day. And in terms of music, art, and PE, they will be provided throughout the day. Students will have access to lessons and materials in an asynchronous manner so that they can complete them on their own independently during the day. There'll be a block for lunch, and then at the end of the day, the students will be reconvened with the teacher to kind of close out, debrief the day, see what questions have arisen, and get ready for the next day.
Do you anticipate to be able to keep it to small class sizes since they are in a virtual platform and it's going to give them a little bit more one-on-one instruction?
So it's going to depend on the demand and the number of students that enroll for the grade level and the number of teachers. So the class sizes may be about the same or maybe a little bit higher depending on the demand for the grade level and the number of teachers that we have.
And can anyone speak to a parent that may be on the fence, that is wondering, whether or not they should be sending their child to in person or to play it safe and stay at home? Can any of you speak to sort of what they might consider if they're considering that?
I think we always want to encourage and remind ourselves that parents are in fact our children's first teacher, and they know their children in a way that even as teachers we may not know as much about our children as obviously parents do. So I think it is a very much individualized decision. I think it has a lot to do with things like, can the student do work independently? Are they able to self-regulate? Are they doing okay from a social emotional standpoint of not feeling isolated? And then there are other questions around, is the child in a home where maybe there are some individuals who may be of extremely high risk and perhaps the parent may be concerned? We recognize there are a lot of factors that influence that, which is why ultimately we decided that we would invest and in fact take the loss of funding from the state so that we could offer this to our families. We always want to do everything we can to meet their needs. If we can, we're going to work towards getting to a yes before we look at all of the reasons why we can't.
I would add, Alex, too, I think one of the pieces, if you have a parent that's on the fence, last year we did see on average by the end of the year about 65% of our elementary students in attendance. And so I think that for those parents that have experienced it, been a part of it, and seen all the safety measures that we have and have allowed and entrusted us with those students, we know that we can meet those needs effectively too.
I want to, before we get to some of our questions here, I want to follow up on one point I hear about a lot, which relates to exactly how campuses are going to behave, which is lunch. People really want to know about lunch. Kids obviously have to take off their masks to eat. We have already heard from Austin ISD saying that we are planning on having lunch in cafeterias because we will not be having them in classrooms. So can any of you speak to why that decision was made and how we can ensure that students will be protected from themselves, from one another, and hopefully prevent the spread of COVID?
Dr. Mays, you want to take that one?
Sure. I think it goes back to what Dr. Elizalde said. It's a both and so it's where we can provide lunch in the classroom or opportunities that we will. It just depends on staffing and availability of resources at the campus. But regarding lunch, we do plan on, for the most part, having lunch in the classroom or leveraging outdoor spaces. And so the guidance that we provided for principals as well as our teams is to make sure that, again, one, we have that assigned seat for contact tracing, because our team does an excellent job of contact tracing to try to mitigate the spread of COVID-19. And so that's a big component of it. But again, leveraging all of the spaces that we have around our campuses to make sure that students can social distance or be able to eat comfortably is something that we plan on doing on every campus.
I think I saw one South Austin elementary school on Twitter today posting picnic tables outdoors. So it's clear that some ideas are really already floating out there. We already have more than a dozen names of people who had questions that came to us through Zoom. We're going to take you one at a time. And keep in mind, folks, we do have a time limit, so we're going to try to get through as many as possible, feeding both in-person Zoom questions and some of the questions that have been submitted through the chat box. So first up is Rachel Gossin. Rachel, do you have a question for us?
No, I'm sorry. I don't.
Okay, our next name is Debbie Torres. Debbie? Debbie, can you hear us? If you have a question, you can go ahead and ask it now.
I don't have a question. My name's just in the view.
Okay, we'll start by asking one of the questions that came into our chat. This one's from Emily Sawyer. Will there be options to select virtual later on after the application closes if the health conditions continue to deteriorate here locally?
So many of those questions are going to be very difficult for us to actually give the response that we want to give. Obviously, my initial response is we want to figure out a way to say yes. The reality is it's going to depend on the conditions that do change. It's going to depend on staffing. It's going to depend on what percentage of students are reporting in person, what percentage are in virtual. So our goal is always going to be to do our very best to monitor the situations and then adjust as necessary. So unfortunately, I don't have that information, as the conditions have been changing, as we've seen just a month ago. We all thought we were going to be in a very different place than we are today. And so I think our team has elected that our parents at home are no longer pivoting either. It's as if they're on a swivel, because it just keeps continuing to go around and around and around. So unfortunately, it's really challenging, but we're going to continue to see how we can meet everybody's needs.
Another question, and in fact, I'm going to combine two questions here, which are about masks, and it's obviously one of the hottest topics when it comes to considering COVID-19 safety protocols. And there is some differences between federal CDC guidelines and the way that school districts are hamstrung by state orders. And so I want to find out a little bit about if there are ways that Austin ISD is considering either reinforcing those masks or bringing it to a higher level. For example, Christy Donmoyer said that per CDC guidelines, masks can be mandated on buses. So is there anything that AISD is doing to think outside the box there?
Yeah.
Well, we are going to be expecting students. We are following that. Transportation is one area in which we can require those masks. So students riding our buses will be required to wear masks. And we want to partner with our parents. We wholeheartedly believe that all our parents want to do what is best for their child, and what is best for all of our children, and what is best for all of our staff members, who I know our parents love and adore, our principals, our teachers, our counselors, our support staff, everyone, is that we need to mask up. And we're asking everyone, we need everyone to wear our masks so that we can protect others. There was a teacher, and I don't remember which school it was at. I wish I could, so I could give her a shout out. She has a beautiful bulletin board that is all heroes wear masks. And so let's ensure that we're not causing any family any horrible situation. Let's wear a mask.
As a quick follow-up, do you anticipate to get any pushback from both parents and, of course, our governor, who has said that school districts can't mandate masks?
Well, I think that's been an ongoing kind of pushback throughout this entire process. And we are, again, going to continue to say, this is not something that any of us individually have decided. We are utilizing facts and science and the health that organizations like the CDC know work. What we know works. We did not have outbreaks in our schools last year, even with 65% of in-person attendance at our elementary campuses. And what did we do that was so different? We had masks everywhere. So I anticipate that there will still be some argument about it. For us, it isn't an argument. Masks are the way in which we can keep everyone safe. Why would we want to take a risk by not putting a cloth over our nose and mouth?
All right, let's try another question from our speaker queue. Again, if you raise your hand, you will be added to our queue. We have Jonathan Weldon, who has a question. Jonathan, if you still have a question, you can go ahead and say it now.
Hi, can you guys hear me?
Yes, we can.
Great. I have two questions. One is actually in regards to programs like Take Flight. How will those be administered both in class and then also virtually? And then the second is, given Austin's march towards stage 5, do you have any indication or have you had any discussions internally about delaying the start of school?
Let me start with the delay of school start, and then I'll turn it over to Ms. Casas on the question regarding dyslexia services and other similar types of services. As we saw last year, which we did delay the start of school, the challenge with that is that we really have no way of knowing how long a particular surge or stage will last. And the longer we keep from beginning school also means we have to push those days out into the summer. And right now it may not seem like, oh, it's okay, we'll push it into the summer. I can tell you from experience from last year, as we were needing to make that decision, it's not that popular as we get towards the end of the school year. In addition to that, if we delay the school, we get started and we have another surge, do we stop school? One of the things we also know is the starting and stopping has actually been another issue that has created some additional anxieties. And we recognize that there are so many different perspectives, and someone may see it this way and someone else may see it this other way. And I think it's really an important question, and we're going to continue moving forward with our safety measures at this point. And everything that we say is always going to be subject to change as we are monitoring the conditions each and every day. Ms. Casas?
Yes, so in terms of dyslexia and special education services, they will be provided based on the student's education plan, individual education plan. So in person, the groups are normally between 4 to 6 students with the teacher. And so we'll use the plexiglass. The teachers have the face shield so that the students can see the teacher's enunciation of the words. Similarly, our speech therapist also have those available to them. For students who are in remote setting, they will be built into their schedule so that they continue to get teletherapy through our virtual platform.
Ms. Stevens has joined us. We haven't had a chance to speak to you yet. There was one question here from, I assume might be a teacher. Josie Flower asks, how will virtual teachers be chosen and will it be at random?
So we're looking at our numbers right now. So we looked at what our projections were for this upcoming school year versus the number of students who've currently registered. And then we're looking at the number of students we have who've submitted an application from virtual, lining all that up to see if a campus right now has less students registered than were projected. And then they also have a group of students from their campus who have applied to do virtual. And we'll look at those campuses first in terms of identifying a teacher. What we will be doing is asking for volunteers from that campus and see if we have someone that's interested in doing the virtual option. And we're hoping that we'll get a volunteer from the campus to be the virtual teacher for a specific grade level and program.
Sounds like a very complex formula that you're following there.
It is.
Well, we think it's important that this be about choice also. We don't want a teacher who doesn't feel like that's their forte to utilize virtual instruction as their main instructional delivery model. We want someone who wants to do that, because this has to be a win-win all the way around. So we would, getting to a point where we would require a teacher to do that. We're very fortunate that Austin ISD, we saw some teachers doing amazing things utilizing virtual instruction. So we're very confident that we'll have teachers that will step up and say that's something that they would want to do. I think we have a tendency to say this is better than or worse than, and we're going to work really hard to stay away from polarizing and binary conversations. We need to look at a both and if we can meet everyone's needs, then we're going to do our very best to do that.
We have another question that's coming in into our speaker queue, excuse me. This one is from Kate Fight. Kate, can you go ahead and pose your question now?
Thank you. Can you hear me?
Yes, we can.
Great. Thank you so much. I have a two-part question. The first is, have y'all considered having classes where parents opt in to say my child is going to wear a mask versus classes where the parents have said my child will opt out of wearing a mask? so that while there's no mandate in place, the parents to some degree have an agreement, especially in the elementary schools. And then my second question, and I think you started to touch on this just a moment ago, is how we ensure if our child is remote for the fall, that they have a smooth transition in the spring. And I'm especially concerned about in sixth grade where I have a child on the advanced math track. And if they don't have a teacher that is from their campus and keeping pace with the in-school class, then I am concerned about how that transition will occur in January. Thank you.
So I think the first part with regard to students being separated, masked versus unmasked, that's a really difficult thing for us to, as we even had that conversation as an executive leadership team, with regard to parents and what they're choosing for their children, and for us to say these 7-year-olds would be in this classroom and these 7-year-olds would be in this classroom, really creates an environment that that puts children in a very difficult situation. So what we do think would be helpful for parents, it would be for us to be able to give parents an idea of what percentage of our parents are saying they want their children's masked on our campuses. So we're in the process, Dr. Mays is in the process of working with our campus principals, because what I have heard from many parents, I think all of us have, is, well, what percentage of this school will have children that will be masked? At the same time, if it's an individual situation that we might be able to work through, I think that is what makes Austin ISD unique, is we need to balance out some consistency while also maintaining that equity takes form in all different ways. And so if there is a way for us to work through certain situations, Dr. Mays and his team are going to continue to reach out. And I would encourage a parent to reach out directly to their principal. And if that isn't successful or they're having difficulty, to reach out to Dr. Mays. And that second part, I think the transition, I don't know if Dr. Mays, you want to start that one?
Yeah, we can probably both tag team that one. But as far as the curriculum goes, those teachers still will follow the curriculum that teachers on the campus will follow too. And so transitions, regardless of what grade level or student we're talking about, it should be a parallel path. And I'm sure, like I said, Ms. Casas can extend on it.
Yeah, all of the teachers are following our year at a glances, and so the scope and sequence of the curriculum that will be delivered will be the same whether they're virtual or in person. And while we can't guarantee that they get the teacher from their home campus, we are doing everything we can to try to mitigate that, but it'll depend on the number of students that enroll in the virtual option.
You know, then that brings up another point, which is, for right now, AISD is only really committed to a fall semester of virtual learning, saying students are expected back in January on their home campus. Do you foresee it possibly being in the realm of bringing this back for the spring if things don't continue?
Well, I think there are two things that really affected our decision, or impacted our decision to offer the virtual learning. And one of those was the fact that vaccines are not even available for students under the age of 12. And so it's not even a possibility. And so that did play a huge role. And that also affected the semester time frame to start with. Our best case scenario, from what we're hearing, is maybe late September, early October, when vaccines under 12 may be available. Knowing what we know about the course of treatment, that's a shot, a vaccine, 3 weeks later, another one, and then 2 weeks after that before you're fully vaccinated. So that's going to put us into Thanksgiving or the first week of December. And that's saying everybody would line up and get it all at the same time. And so, again, the idea that we also have to recognize its impact on our staff and our team members as well. And so having a teacher, no, you're doing it this way for 2 weeks. No, now you're back in person. No, now you have this many students. Really what is best for our students and our team members is that period of time. Now, if we arrive and we still see, you know, that the horizon is very far away, we absolutely may be making some additional extensions or expansions of the current virtual learning. All of that will be subject to the conditions.
I think obviously we can all say our fingers are crossed that, you know, things will be safe within the schools and that there will be no transmission, but obviously it might happen. And in which case AISD will have to act and send some kids home to quarantine and to isolate. And so I'm hoping one of you can lay out some specifics about what exactly that looks like, both from a health and safety perspective in terms of how long it takes and how long they'll be absent. And then again, from an academic perspective, how are those kids going to keep up with their lesson plans when they're not a virtual student, they're an in-person student?
So I guess I can start with the response as far as the students' needs. And so the first layer, of course, is the teacher. And so we're hoping that, you know, correspondence can take place there via email so the teachers can correspond with those teachers. We also expect for our campus leaders to designate some time and some hours for teachers to be able to be responsive to that. The next layer that we have is designated teachers at the district level that can also be responsive if students have to call to have those needs met. And so we're looking at identifying teachers that can solely focus on meeting that need for students that have to be in quarantine. And then the next thing that we're working to build is we're actually looking at a telehealth platform for like a tutor hotline that can also serve as an additional layer of support for students. And it's been pretty cool for us all to sit around and try to be creative to create some solutions for some of these new problems that we have.
Yeah, and the fourth layer is the connection to the blend course. The student will remain connected to the teacher and their class and their assignments using our blend platform.
So even though they are a designated in-person student, if they have to go home in quarantine, they will still have access to the virtual learning plan and will be able to keep up that way?
So our blend platform is where all of the curriculum is loaded. And so whether you're in person or virtual, you have access to it. And so a student in person will also be connected through the blend course and assignments to be able to upload them. We've learned a lot with technology and there's less need for paper, pencil, and there's some things that can be done digitally. So the student will remain connected to their teacher through their blend course.
Ms. Copeland, can you walk through once a student or a staff member is positive, to directly answer that isolation and quarantining component?
Absolutely. So we are still going to be quarantining individuals this school year. And we are unique at AISD where we do have a public health team. And so we individually treat every single case, which is different. We don't go through a system. We do consult with our health authority, but we know that that's really important and that worked last year. So we're going to continue to do that. Whenever we have an incident, they reach out to the health services team and we individually process every case. So we will be having seating charts this year that will help with contact tracing and really hoping to group students together to kind of limit any extra exposure. And we are going to continue to be transparent with our community. So we will still have notifications that go out. We will be updating our dashboard daily. And we did make a change to our quarantine length at the end of last school year to be in line with CDC because they adjusted it. So we will have a 10-day quarantine procedure and we will have rapid testing available for those that want screening, and that's what's recommended. The CDC actually just gave a new update a couple of days ago. So they are recommending testing between days 3 and 5. And so we put that in our letter too and strongly encourage that. And we do work with campuses. So every campus has a COVID designee and an alternate. And so we make sure to keep things confidential, and they are the ones that work with health services. And so it's a whole system and process that we have, and we're going to continue that into the new school year.
Have you considered leading the way in terms of proactive testing and enforcing students get tested maybe once a week? I think I've heard you speak about this in board meetings, where this is a way that you can catch COVID-19, asymptomatic COVID-19 among students and staff before it becomes a transmission within the building.
Yes, absolutely. So Dr. Myers was in the board meeting and she did mention asymptomatic testing for schooling. So we will have the rapid testing available on all of our campuses in the health rooms. We are working now to try to set up hubs to try to do asymptomatic testing, especially prioritizing those areas that have been COVID hotspots during this pandemic. We've also prioritized them for our vaccine initiatives that we've been doing. And then we also prepared to do our rapid testing events too, if we need to again. So everybody's on board. Our nurses are ready too. And so, we're ready to offer that to our students and our staff.
Are you able to mandate it from the students to get tested once a week?
No, we cannot mandate testing, but we can strongly encourage testing. And especially if somebody's symptomatic, we definitely want them to get tested too. So.
But our experience from last year was when we would say, like if we do think about some areas where primarily that were related to extracurricular type activities, but where we did have, and we said, we're going to test, we did not have individuals saying, no, I don't want to test. That just wasn't the way in which people responded. But as Ms. Copeland pointed out, like there are some areas that we're already following. As I said, we really do pay attention to all of the data. Ms. Copeland looks and researches that. So take, for instance, 78744, which is an area that is once again showing a high positivity rate. We will be able to say, we're going to offer testing on Monday for the next 2 weeks when school gets started if we still see those positivity rates. Now, a parent can choose not to have their child tested, but again, our families want to know. So that hasn't been the issue. And so she will work with her team as she did this past year. Sometimes they did drive-through testing, as you may recall, throughout several locations. So really thank you for raising that, because that is an awareness we want everyone to be fully informed on.
Let's take another question from our Zoom audience. Jason Turner, you're next. Jason?
Thank you so much. Can you hear me?
Yes, we can.
Appreciate your time, Dr. Elzalde, and the other members of your staff for taking out of your evening to answer some of our questions. I wanted to address the facilities themselves. I know the district is a large district, and with the funding resources we have, we are behind the 8 ball. What is the district doing in regards to increasing the air inside the schools? Because if students are going to be wearing masks, the CO2 inside that mask is going to be higher already inside of a classroom with high CO2 rates. So are they going to follow CDC and ASHRAE guidelines by increasing the airflow inside those classrooms? Because our principal said they're using air purification, air purifiers, and HEPA filters, which do not help inside the classroom regarding COVID transmissibility. That was proven in the science or the restaurant case in China. So again, what are they doing to address the facilities themselves in order to make them safer? We've heard about masks, we've heard about virtual learning. What about the facilities?
Yeah, so we may have been looking at different research studies, and I'll certainly want to follow up with the one that you're referencing. There was a study that they actually used a classroom and did put particles, obviously not COVID, but representing the airborne COVID, and then had a classroom that had an individual air purifier, and then a classroom that did not. And they were colored particles so they could actually follow what occurred. And so this happens to be one of those that did show that it did have a reduction, a significant reduction in the particles in the air. So we know that it does help to some extent. We also know that the filters do help, but they also, the part that I absolutely am in agreement with you is when we use and many people have asked about the level of MERV filters that we have. And it's a double-edged sword, because the thicker that your filter is, the less air that actually gets flowing through there. So our best case scenario is, wherever possible, to also ensure that if they do have windows, we want those windows to be opened. We also want to ensure that our classroom doors are opened rather than closing those doors, because even that allows for additional circulation. And so in some instances, we may also need to look at the size of the classroom in terms of the number of students. I know Dr. Mays is working with principals. We may be moving, if this class has fewer students and it's a bigger space, we may be moving students. So we will continue and to know and agree with the fact that air flow is very important. Outdoor classroom space is also a place in which we want to use those outdoor facilities weather permitting, which we think in Austin is more than not. So we think we'll be able to use a lot of outdoor spaces. If there's a classroom that seems to be much larger and we're looking for space, we might end up using a library, or we might use a gymnasium. I heard Dr. Mays the other day, we might need to take part of a cafeteria to have a classroom if we think that the density is not going to be of the best. So we're layering those issues that we have available, but every classroom will have an air purifier in every single classroom that we have. We have 5,000, a little more than 5,000 teachers, and we will have 5,000 of those air purifiers.
The buses also will have, one of the recommendations that we have even for the buses is to make sure that the windows remain cracked. I mean, we want to make sure that we have good airflow in all of our classrooms and the buses, so you'll see that.
Our next question is from James Mosley. James Mosley is on the line. James, go ahead.
There we go. Can you guys hear me now?
Yes, we can, James.
Hey, so I had emailed the Board of Trustees and the superintendent, and I know this is a difficult question, but it really rankers in me that until you guys have actually sued Governor Abbott and the TEA and forced the Supreme Court or any lower court to rule in his favor, you guys haven't tried everything to be able to enforce your mandates. I get it that, you know, he's doing this under the Texas Disaster Act and that he has broad powers, but there's a number of legal arguments you could make in terms of are his orders actually germane to public safety under the guarantees of a free public education in the Texas Constitution? That's another point that you could argue, that his orders are, you know, basically unconstitutional. And as far as I know, not a single school district has chosen to do that. Y'all could have banded together with another couple of large ISDs such as San Antonio, Dallas, or Houston to split the legal costs, and fairly quickly you could get your, you know, answer from the Texas Supreme Court and at least be able to tell parents, we tried everything to enforce mask mandates, but you failed to do so, and I want to know why. Yeah, so obviously a very fair question. We have both talked with other school districts. We've also taken on outside counsel that have this area of expertise that you're referencing. And there are a lot of different consequences that can ultimately occur to our district. And some of those include the fact that under new regulations, the Commissioner of Education also has the authority to take over school districts, which could mean replacement of all of the elected officials and replace them with appointed. No, what I'm talking about, ma'am, is doing this in the middle of it, not actually rebuffing or ignoring the order and allowing the state to take over at that point, but at least follow the orders as they are issued now, but then work through a lawsuit. And then if you lose, you lose, but if you win, you win. So just the filing of the lawsuit itself would not subject the school district to any negative consequences.
Well, I think our legal team has a different take on that.
Well, then you need to get a new legal team.
Thank you, sir.
Okay, we're going to take a new question from the next person in queue. That's Amy Kraisman. Amy?
Yes, thank you for taking my questions. And James, I love that point. Well, my question is, my concern is about the mental health of all the scholars and the staff. And I want to know if there have been an increase in hiring of mental health care workers, social workers, and school nurses. I'm a psychiatric nurse by trade, and I'm deeply concerned about the mental health issues for the students that will be attending school in person who have not been attending, but I'm also concerned for those who are still remain at home. So what are the new protocols? Are there any additional protocols, and who will take like one-on-one assessments of all the students?
So I can I can start the response there. So our counselors are always the first initial contact at the school since they have direct relationships with our students. And then from there, we do have a whole department of licensed mental health professionals that are available. And then our new contract with Gramercy is also available. But we recognize that students have been through a lot this last year and a half, and we're prepared for that. Our team is working very creatively to make sure that we have some lessons that are prepared for the first 9 days of school so that teachers can give students some space and opportunities to talk about some of their experiences and also really connect with the students and develop relationships so that they can learn their children in the classroom and they can recognize the symptoms if students are exhibiting so that they can refer them to the counselor or one of our licensed mental health professionals. But we have been talking to our school leaders and teachers in preparation to make sure that we have the supports available as they're needed.
Yeah. And that won't just be at the beginning of the year. It'll take place throughout the year. We actually kicked off this summer with a focus on that social and emotional need for our students with a lot of different camps and a lot of different ways to engage those students. And what we saw is that, you know, students were ready to get back to each other. They were ready to hang out and have fun. And so it was really about addressing those needs through engagement and trying to make sure that we had the resources there to meet those needs if they came up. But students were really excited about getting back to a sense of normalcy, and we saw that this summer with the level of engagement that we had with students in our summer programs.
And to follow up on her question about hiring of more mental health counselors or licensed professionals who know how to handle that type of that trauma, is there any plans for that to happen, or does AISD have enough staff in order to accommodate that?
We did make some adjustments from the perspective of our projections for the number of students that we will have is lower than what we've had in previous years. However, the staff that focus on mental health was an area that we did not make any reductions. As we did in other areas, obviously you have fewer students, you will need fewer teachers. In this instance, while we had a projection of fewer students, we did not make any adjustments. We kept everyone on board. And so actually what that will do is it will lower the number of students per counselor, the number of students for our licensed professionals and alike. So, and it will be one that we're gonna continue to follow up on as we see students return. And we also have all of those available for our staff as well, because as the caller mentioned, this is about our students and our staff. And staff have also been through quite a bit of turmoil, and all of these are accessible for them as well.
She did mention nurses too, so we will have full-time coverage on all of our campuses for nurses coming back. And one really thing that we're really excited about is we are partnering with Del Med to bring our TCHAT program in. And so they are, it's going to be on all of our middle school and high school campuses, and they are able to provide up to 4 free sessions for students. And they can help with crisis support and also connecting our students to psychiatric medication if they need it. And a lot of the nurses and the school counselors and our licensed mental health professionals will be the liaisons in that. And so again, another system that we have to have everybody work together to be able to meet those needs of the students.
Something for parents to follow up on. We have about 5 minutes, give or take. I know we started a few minutes late, but we're going to try to get through as many of these speakers as possible in that remaining time. David Trujillo. David, are you there?
Can you hear me?
Yes, we can.
So my question is, what is the basis for assuming that it would be safe to start the semester when it's projected that will probably be in the peak of the transmission? I know that you talk about the success you had last year, but you had less students, a less transmissible variant. You had masks as well as temperature screenings and a lot of other measures. So if you're basing your anticipation of success on that, I want to know what leads you to believe that it's going to be effective this year when you have such different conditions. And kind of along those lines, what's going to happen hopefully that is not the case, but if you start having a lot of students and teachers being exposed, even in those first days where you have multiple teachers out, multiple students in quarantine, I just want to know, like, big picture, what is the plan if there was like a massive transmission?
Well, very simply, if there's a massive transmission, we would absolutely close a school for the period of time that Ms. Copeland would work with Austin Public Health. We won't hesitate to close down a classroom, close down several classrooms, or close down a school if that's what is necessary. We're basing it not just on some of prior years, but also on what the CDC is saying. And the CDC is saying that it is safe for students to return, specifically, even if there's high transmission, if masks are worn, when masks are worn. And that is why masking is of the utmost importance, second to vaccines. If you're able to get the vaccines, we know that the vaccines mitigate the illness tremendously, and then masking is our next layer. And so we're going to continue to monitor, though, because excellent point, we will have to see how things evolve and as we do. But we have had, having a nurse on our campuses, being able to immediately identify where we have a case and who has been in close contact will continue to help mitigate that we don't have a spread. And so the seating charts and knowing where students are and having students in as much outdoor space as possible from time to time throughout the day will allow us to continue to communicate. But we won't hesitate. If there is any concern, then we will absolutely close the doors to that school until it is safe to open it.
That is something that we monitor closely between Ms. Copeland and I. We're in constant communication to try to troubleshoot what action we need to take or what recommendations we need to take to the superintendent. Because like you said, I know Dr. Elizalde is always about us erring on the side of safety first. But again, we stay on top of that all throughout the night to try to make sure we make the best decision for our students.
The Austin ISD staff has agreed to stay on for about 10 more minutes since we started late, and the Performing Arts Center is going to keep the lights on for us. Let's take our next caller. We're going to ask for the questions to be concise, so that way we can try to get through everyone, okay? Monique Diaz.
Hi, my question is there a limit on how many students will be able to learn virtually? If so, how many students per grade will be able to learn virtually during this fall semester?
Yeah, at this point, the number of requests that we've received are completely within our ability to provide quality virtual instruction. And our goal here is not to begin to have to decide who gets that opportunity and who doesn't. And so at this point, the number of requests, we know we still have another day available for those inquiries and applications. But at this point, we feel very confident that we can serve all of the students. And so we are not anticipating having to say to some of our parents, yes, you can, and some of our parents, you cannot.
A quick follow-up. You've extended that invite to out-of-district families, of course, with the caveat that they'll be first put on a wait list. How realistic is it that those out-of-district families will be approved? And if so, are you planning on charging those families tuition?
We haven't gotten that far. I think there is some possibility. I will also say the possibility is probably getting less as our in-district applications have increased, and we will serve our students, of course, first. And so there's still an opportunity, but so much of it will depend on how many students are in a grade. So let me give you a real quick example. I know we want to be concise. If we have a classroom, we've taken care of all of our in-district students, and this classroom teacher has 18 third graders, and there are 4 out-of-district third graders. We can add those 4 out-of-district third graders to make a class of 22 and be able to provide that to some other families as well. You know, at the end of the day, we want to meet the needs of our Austin ISD students, of course, and also we want to humanize this entire operation because after all, they're all our children.
Okay, our next question comes from Lisa Albrecht. Lisa? Lisa, I see your hand raised there. If you still have a question, go ahead.
Can you hear me? I have
Yes.
several questions. You may have, I'm not sure if I've gotten a clear answer. So if we opt for virtual, say for our elementary student, we're not necessarily guaranteed a teacher at our school. And then the follow-up with that is then if they went back in the winter or spring semester, then they would be transitioning to a completely different teacher at the school. Is that correct?
That is correct.
Okay. Another question I have is, so is there going to be transparency? You've asked that we fill out a questionnaire, whether we'll ask the teachers to ensure that our student is wearing a mask. Is any of that survey, or any of those survey results going to be given to us so we'll have some transparency about numbers before we have to make a decision about whether we want to send our kid virtually or not? For instance, if the survey shows that 95% of the kids at our school are wearing masks, maybe we'll choose to go virtual. If it shows a lower number, maybe we won't.
Yes,
Absolutely.
absolutely.
And
We recognize
that the time frame.
I'm
I'm going to stop for a second.
If you could go ahead and mute for right now while Dr. Elizalde answers your
Yes.
question.
Let me try again. There we go. Absolutely, and because it is such a tight timeline between our virtual application and school starting, we will provide the response to those surveys that we're getting and still allow those of you, even if you've said we want virtual, and then if we are able to demonstrate to you 96% of the students, of the parents at this school have said they want us to ensure children are masked, and that might affect your decision, we absolutely will work with you on those decisions because we recognize that the timing is really tight.
Lisa, thanks for your question. Sumi Sripatham, please. Sumi, go ahead. Sumi, if you're there, you can go ahead and unmute.
Can you hear me now?
Yes, we can.
Okay, my question is for 7th graders. My daughter is in 7th grade, but she is not 12 yet. So she is not eligible to be vaccinated. And we don't have the option of virtual right now. Do you all have any plans for corner cases like this?
I think that's an excellent question that I'm looking at our team because that sounds like we need to personalize this.
Right.
So what I would ask you to do, if you would please contact Dr. Mays, anthony.mays@austinisd.org, or myself, stephanie.elizalde@austinisd.org. Any of us, we will work with you because that is a unique situation and for other parents that may be in that same situation. Please contact us. We will work it out.
Okay,
Stacy
thank you.
White, your question, Stacy?
Hi, can you hear me?
Yes, we can.
Okay, so mine is actually a follow-up to the previous question because although my child is not in 7th grade, my child is in 8th grade, and there are many 6th and 7th grade students in the same school who are not eligible for the vaccination. So when you say you want to partner with parents and help everyone make safe decisions, but you are only offering the safest option of remote learning to a small age group at a time when other layers of protection have been removed, how can you justify this? And why are you not trying harder to do more than mask encouragement? Why can't you offer remote learning for other students? It sounds like with the numbers increasing as they are, you're going to have to offer it eventually anyway. Why not just do it now? Parents are stressed, kids are stressed. I've called your office to try and work this out and no one is getting back to me. So when you say you want to work with us, I'm not seeing that.
Well, I apologize. I haven't received that message. I'll certainly check with our office. If you'll email me at stephanie.elizalde@austinisd.org, I will get back with you myself this evening. If you send it this evening, I will call you back.
Thanks for your question and feedback there, Stacy. Dara Chambers. We're going to move on to Matthew Lillis. Matthew? Matthew, last call. Christina Schmalls. Bill Fagelson.
Hello? Hello. I'm speaking on behalf of Bill. He's my husband who's here right with me. Our number one concern is that all children are masked. I know you can't require that, but I would like to know some specifics of how you are going to really strongly encourage so that that actually happens. We're just getting very weak messaging around this. I'd like to know, are signs going to be in school that kids are expected to wear masks? Are masks going to be handed out in classrooms and at the entrance halls? Are people going to be asking children to mask up? I need specifics to know. And I also want to let you know that your survey is faulty if you're using that statistic for do we want our children masked. I have a high school student who is very responsible. He is absolutely going to be masked, but he doesn't want to have a teacher telling him to do that. It's not developmentally appropriate at a school where they ask students to take the lead.
So I'm not sure I understood that last part, but yes, we will have signs. We will have masks at entrances. We will be asking students to please mask up. We will be modeling the masking. We will continue to recognize that the vast majority of our parents want their children to be masked, and we're going to help with that process, and we're going to strongly encourage by expecting it to be so. We'll have individual conversations as necessary. We are going to do everything that we can to be able to have all of our students masked.
Okay, we have time for one final question from Rosalie Piedra.
Yeah, hi. I just wanted to know real quick. I think Amy kind of asked my question about mental health support, but I was a former school counselor just this past year, and I feel like there needs to be more, especially this year, a lot more. Also for the teachers, I know there's an EAP, but that I believe is like 4 or 5 sessions with the counselor, and as a therapist now, that is not enough for teachers. Also, what is being done to support teachers if they do come in contact or get infected, so that they don't have to use their personal time? I want to make sure my son's teacher is also taken care of so that she can take care of my son.
So one of the things that's new this year, and it is being provided by our health provider, Aetna, is we have an on-site licensed mental health professional. So in the past, employees did go through our employee assistance program. And so sometimes there was a lag between when they called and when they could get assistance. So we now have an on-site person that is available to our employees right then and there. So we do have that, and that's a new addition from our health provider for this coming up school year. They just started. In terms of our employees, so we'll follow the rules done through our health services. So if you come into close contact with someone, but you're vaccinated, then you will not have to quarantine. If you're unvaccinated, then there is that requirement to quarantine, and people will have to use their own personal accrued days this coming up year, because the federal program ended in December of last year. The district had extended that through June, but we don't have that for the coming up school year. We are looking at an additional option for our vaccinated employees in creating a specific sick bank for those employees to participate in.
Well, thank you to each of you for weighing in on all various topics that we talked about here for the last hour and 15 minutes. Let's get some reminders out for all the folks that are watching us tonight. The first day of school, that's August 17th. For those of you that do want to take the district up on the virtual option, the deadline for that is strict. It's tomorrow at 11:59 p.m., right before midnight. The district has told me that they are going to take the weekend to collect the data, and they will inform families if they are approved, which they've said everyone that applies will be approved. You'll find out on Monday, and you'll be asked to commit to it by Tuesday. And then, believe it or not, a week later is that first day of school. If you didn't get a chance to ask your question this evening, we apologize. Of course, we ran out of time, but the district encourages you to reach out to the Let's Talk platform where you can pose those questions, or as some of the administrators have given out their personal emails tonight, and they said that you can try to reach out to them there. Dr. Elizalde, is there anything that you would like to say as closing remarks?
I just want to thank our parents, our staff, our community for working with us throughout this pandemic. We know that there have been changes right and left and up and down, and we have nothing more except wishes to meet everyone's needs. And there are constraints, there are rationales, even if sometimes people don't agree with all the rationales. And we'll continue to improve on our processes. I want to thank everyone who participated this evening. There was a reason why we didn't do a PowerPoint. We wanted them to have the time. And we want to thank you for moderating and for getting all these questions, even on your Twitter feed. And thank you so much.
Well, thank you again to each of you, and good evening to everyone else that's been following along with us. We'll see you when school starts.